Thank you, and good evening, everyone. Welcome to the North Fair Oaks Community Council meeting for the month of October 2020. Thank you for your time, and thank you to the presenters for making time to come and join us tonight. Mitzi, if we can get started with roll call, please.
Of course. Chair Everardo Rodriguez.
Present.
Vice Chair Juan Carlos Prado. Councilmember Beatriz.
Here.
Councilmember Linda Lopez.
Present.
Councilmember Blair Whitney.
Here.
Councilmember Jennifer Reese. Councilmember Joni Galipsy.
Present.
Councilmember Brooks Esser.
Present.
Thank you.
Thank you, Mitzi. There will be public comment at this time. Anyone may speak up to 2 minutes on any topic not on the agenda. If you wish to do so, you can raise your hand on the Zoom panel, and Mitzi will let you speak for 2 minutes. The council may not discuss or take action on items that are not on the agenda tonight. Thank you. And is there any public comment?
Yes, Chair, there is a couple public comments. So I will now unmute, let's see, Gabriela. So Gabriela, please wait a second once I unmute you, and then as soon as you see the clock, then please commence your public comment. You can commence now. Gabriela? Okay. Yeah,
Sorry, we cannot hear.
Can you hear me?
Oh, now we can. Perfect.
Yeah.
I'm so sorry.
No, give me a quick second. Let me restart the clock. Okay, Gabriela, you're able to speak now.
Thank you. Can you hear me?
Yes.
Oh, thank you. Thank you. Good evening, everyone. Thank you very much for the time. My name is Gabriela Valencia, and I have lived in North Fair Oaks for more than 20 years. Some time ago, some of us in the North Fair Oaks community used to receive via email the agenda for these meetings. But at some point that stopped. And I would like to know why that changed. The North Fair Oaks community has historically been underrepresented and underserved. And one of the things this community needs, I think, is to improve community engagement with the North Fair Oaks Council, which is really the only form of direct community representation that we have in this community. And we don't need any less engagement. We actually need way more. So sending out the agenda electronically to the community members, I don't think is a huge task. And I would respectfully request that we go back to sending the meeting agenda to the community members that had already signed up to receive it. And I do ask that we don't stop there, but that we find other ways to engage and improve community participation in meetings like this one. So I do respectfully request the council to look into this issue that I'm raising today. Thank you.
Thank you, Gabriela. Let's see. Derek Wolf, I will unmute you. Please start as soon as you see the timer.
Thank you. Can you hear me okay?
Yes.
All right, good evening. Buenas tardes to Chair Rodriguez and members of the council. My name is Derek Wolfgram. I'm the director of the Redwood City Public Library, which includes the Fair Oaks Branch Library. As you are aware, we have been closed to the public since March 16th, but we've continued to offer a wide variety of online events and activities in English and Spanish during the closure. You can learn more about these events on our website at redwoodcity.org/library. I also wanted to alert you to a few new upcoming library services. First, while the library will not be open for library services, it will be a 4-day vote center from October 31st to November 3rd, so you can drop off your ballot or vote in person at the library on those days, and we hope to see you there. Secondly, while curbside pickup of library materials has only been available at the downtown library so far, we are expanding to offer front door pickup of library materials at the Fair Oaks Library starting on November 30th. That service will be available Mondays from 2 to 6 p.m. and Wednesdays from noon to 4. And we will also have the book drop open to accept returns on Mondays and Wednesdays. If you need to return materials another time, the downtown book drop does remain available 24/7. I also wanted to let you know that while there's county Wi-Fi that already covers the parking lot of the Fair Oaks Branch Library, we have added capacity to our downtown library Wi-Fi so that the whole large parking lot at Middlefield and Jefferson has a strong Wi-Fi signal now if you're looking for a place to get online while libraries are closed. And then also I wanted to let you know that beginning November 30th, starting at the downtown library, we will have computer access and printing access by appointment only. And if you have any questions, you can contact me at 650-780-7060 or by email through the library website. Thank you.
Thank you. Mitzi, is there any additional public comment?
Yes, there is. Give me a quick second.
Of course.
Miss, I'm sorry, I might butcher your name, but Elute, I will unmute you now, and then as soon as you see the timer start, please start your public comment.
Good evening, council members. My name is Graciela Olate. I have been a resident of North Fair Oaks for over 20 years, and it's quite a coincidence that Ms. Valencia spoke to the same issue that I have. I used to receive a notice about the agenda for council meetings, and that has not happened in quite some time. I feel like I'm a person who really tries to stay involved in the community happenings and the community news. And it's a struggle sometimes to try to find out what is going on with the county and community council meetings. So just to kind of piggyback with what Ms. Valencia said about community involvement, I'd like to see that start up again. Thank you.
Thank you. Is there any further public comment?
Yes, there is. Let's see. Okay, Rebecca, I will now unmute you. As soon as you see the timer start, please commence your public comment.
Yes. Hello, my name's Rebecca Keeler. I've been a resident here for 13 years now in North Fair Oaks. I just want to second the last comment and Ms. Valencia's comment. In 13 years, until just a couple months ago, I didn't know this organization existed. I've asked my neighbors and they didn't know it existed. So I also would really like to be involved in my community. I would really like to encourage community involvement from my neighbors. And I'd like to encourage, and I'm happy to step up if there's some way that I can help make that happen. Please reach out to us and let us know. I think it's very important that an area like this that is so underrepresented has some voice. And so please let us know how we can help facilitate that. Thank you.
Thank you. Let's see. And I believe that is it. Thank you.
Thank you, Mitzi, and thank you to all the speakers for their public comment. This time, I sent several emails to not only some of the longtime residents, but also to some community-based organizations in lieu of the presentations that we were going to have tonight, because I thought they were very relevant for North Fair Oaks. So hopefully, those are some of the voices that we have heard, and yeah, we look forward to discussing the possibility of distributing the agenda more widely through the community, and we will look into that. Thank you very much. And moving on to the next item on our agenda, we will have a presentation on voting on the elections, very timely, given that we are a couple of weeks away from the final date. And this presentation will be provided by Diane Leeds from the San Francisco Peninsula People Power.
Okay, so Mitzi, you'll be able to advance the slides for me?
Of course.
Okay, so again, I'm Diane Leeds. I'm with San Francisco Peninsula People Power. We're a nonpartisan grassroots civil rights organization that's been around since 2017. And I'm also co-chair of the San Mateo County Voter Education Outreach Advisory Committee. So I've been working very closely with the Elections Division for a number of years. San Mateo County is actually in pretty good shape in terms of this election. And again, it's no longer election day, but election season. People could start voting on October 5th, and there's been a lot of activity. So again, we've had a lot of experience in this county in terms of, getting ballots to every registered voter and providing a number of different ways that people can vote and a number of additional days when they can vote. So again, everyone who's registered receives a ballot in the mail. You can take your ballot at home. You can go through it, mark up your ballot, and return it in a number of different ways, including mailing it through the Postal Service, dropping it off at a ballot drop box, or dropping it off at a vote center. Now, one of the things that's really important in terms of if you are mailing or dropping off your ballot is that you do it before 8 o'clock on election day. Otherwise, your ballot will not get counted. And in fact, the main reason that ballots don't get counted is because they are not postmarked in time. For this election, your ballot can be received up to 17 days after election day, so up through November 20th. The other way you can vote is a system called remote accessible vote by mail, which historically has been targeted towards folks with visual impairments, where you can use screen reader software on your computer to bring up the ballot, and then you mark it on the screen, but you're still printing off the ballot and mailing it back. So again, it's not voting via the internet. It's just being able to download the ballot onto your computer. You have to get a link from the Elections Division in order to use that system. But again, it's now open to anybody in the county who wants to use it. And then obviously, it's very important that people are able to vote in person. Just to give you an idea of how busy things have been, at least in this county, as of 5 o'clock this evening, over 35% of registered voters have already cast their ballot. There's been over 150,000 paper ballots received, and a little less than 4,000 people have voted in person. So again, we've got over 155,000 ballots that have already been cast. Next slide, please. So what I did here was just show you the, in terms of drop boxes and vote centers, the ones that are closest to North Fair Oaks, but there are 39 drop boxes in the county, and you can use any one of those. 32 of them are located outside so that you can get to them any time of day or night, any day of the week. So the ones that are closest to North Fair Oaks is at the Community Activities Building on Roosevelt. And again, that is an outside drive-up type of secure drop box. And then there's one at the county center. It's a little hard to find. I actually went on Saturday to drop mine off. That one's on the corner of Middlefield and Bradford. In terms of vote centers, there's only 3 that are open right now, one at County Center, but right now it's just only open on weekdays. And then there's one at the Tower Road Elections Office and South San Francisco Library. Now, starting October 31st, there's going to be 45 vote centers that are open, and there will be open from the 31st through Election Day. In addition, the county has some pop-up vote centers out on the coast and in East Palo Alto. And then new this year, they have a mobile vote center that started up at Saramonte Mall. It's going to go out to the coast. It's been at the Half Moon Bay Airport, and it'll end up at Hillsdale. So again, they're really trying to do as much as they can to make voting accessible. You may notice some vote centers, I don't think it affects anyone in North Fair Oaks. Some vote centers have changed from the primary, and that's mostly so that they could be in larger places so that we could practice social distancing. And every single vote center is following COVID-19 regulations. The Secretary of State's office published a 50-page document for county elections officials to follow in terms of making sure that everyone can vote safely at a vote center. Next slide. One of the things, so in addition to ballots arriving late, the other reason ballots don't get accepted is people forget to sign the ballot, or their signature does not match what is on file. And what's on file is either what is on your driver's license or California state ID, or what your signature was when you originally registered to vote. So it's really important to make sure that you sign and date it. Now, the county does makes a lot of effort to make sure that they can accept all signatures. It's more for signatures not being there at all as the reason for ballots not going through, but they will contact the voter and give them an opportunity. They'll send them a postage paid envelope where they can sign an oath and send it back so that their ballot can be counted. The other thing is you can also have someone return your ballot for you, so long as they do not get paid for doing that. So in the lower left-hand corner of the ballot envelope, that's where the voter would basically give permission to someone to return the ballot for them. So if you have someone who is housebound, doesn't trust the mail, would like to have it dropped off either at a vote center or a drop box, you can do that. Okay, next slide. So some of the things that are really important, especially for new voters, you do not have to vote for every single office or proposition on your ballot for it to be counted. And especially for this election, some of those propositions are really difficult to understand. So again, vote for the things that you feel comfortable, things that you feel you have enough information to vote on. And as I said, and I can't say this often enough, make sure you sign the back of the return envelope if you're voting by paper, again, whether you mail it or drop it off. The other thing that's important for people to understand is every vote really is important. There have been so many elections that have been decided by coin toss or fewer than 10 votes. The example I like to use is when East Palo Alto was voting on incorporation, it won by a margin of 15 votes. So again, it's really important for everyone to vote. And a lot of attention is now on the presidential elections, but local elections probably have a bigger direct everyday impact on us. And again, when you look at some of these races, they really are decided by just a few number of voters. Next slide. The other thing that's really important to get across to people is that we probably will not know final results on election night. One of the reasons for that is more and more people are voting on paper, either through the mail or dropping them off. And so in a way, it's a good thing that we may not have final results, because it means that we're taking the time to count every single ballot. It's an indication that our democracy is working. So it's a really important message to go out to all your friends and your family, anyone you interact with, is, we will not know final results. Now, the good news is for 2020, as it says in the last point, is the counties in California are able to start processing the ballots basically once you could start voting. So even right now, those 155,000 ballots have been looked at by people in the elections division, checking to make sure the signatures are there, the signatures are verified. Then they separate the ballot from the envelope so that how you voted is secret. No one will be able to associate your name with your ballot. So, and then once they've done that, it will go through the tallying machine. Just no one will know what the results are. So hopefully, at 8:05 or when they they say what the first results are, all the folks that have been voting early, which again, 35% of our registered voters have already voted. We will have some good numbers. But again, ballots can show up to 17 days after election day. So some of those could be coming from, military folks overseas, or for whatever reason, things just don't get through the mail in time. So again, just make sure you set people's expectations. We may not know final results on election night. Next slide. So there's whoops. I don't know what happened to that. Anyway, for people that are looking for information, the League of Women Voters is a great source. They have their Easy Voter Guide, which is, a small guide that goes through each of the propositions and explains it in simple terms and what it means if you vote yes on something or if you vote no on something. For folks that are comfortable using computers, going to their Voter's Edge website is fantastic, because in addition to getting information about the propositions, there's also candidate information. You can see for both candidates and propositions where the money is coming from, who's supporting the propositions and the candidates. Asian Law Caucus has information for folks that that speak some other language other than English, and so that people understand what their rights are and what kind of support they can get at a vote center. And then finally, there is a voter protection hotline where if you are, if someone is at a vote center and they feel that they're, being intimidated or something is just not going right, that they're not being allowed to vote, you can call a hotline. There will be attorneys that answer those phone calls, and it will help you out. Okay, next slide. And then just lastly, and I know I've been going through this really fast. I usually do this presentation in around 15, 20 minutes. So I'm just trying to hit the highlights. The best thing to go to if you have any questions or need more information is smcvote.org. One of the things the VOC did was working with the elections division to come up with an easy to remember URL where you could go to one place and get everything you needed to know about how to vote and election results. So you can go to this page and click on, ballot drop box locations to find out where all of them are, vote center locations. And especially as we get to the 31st, when all 45 vote centers are open, they will have a wait time widget. So again, if you, happen to be out and about and you're just curious, what's the wait time at this particular vote center, it will let you know. The other thing you can do there is there's a Where's My Ballot? Track My Ballot. That's a good thing to click on, because you can sign up for a program called Ballot Tracks that is being used throughout California, and you can track your ballot. So you can track it. Like I got notification when it was mailed from the elections division, and I did get notification when the ballot that I dropped off in the drop box my signature had been verified by the elections office and was ready to be counted. So this is a great place to go for all of your questions. So again, I've gone through that really, really quickly. I'm happy to take any questions. I know I skipped over a number of things. So any questions, I'm here to answer them.
Thank you very much, Ms. Diane Leeds, for your presentation. At this point, we'll proceed with council members' questions. Council members, if you have any questions, please raise your hand.
Thank you very much for all the information, Diane.
You're welcome.
Did you have a question, Linda?
Oh, no, I just wanted to thank her for the information.
Oh, great. Yeah, no, thank you. I do have a couple of questions. First one is in regards to the people who are going to be working in the polls. Does it sound like we may have sufficient individuals to attend polls?
Yeah, from my understanding from the elections division is that they have enough poll workers. They actually got more. So there's like 3 different groups of people that work at the vote centers. So there are the actual vote center representatives. And again, they got a sufficient number of those folks. Then there's also people that could volunteer to work at vote centers. And they actually got more applications than they had places to put people. Oh. And then finally, there's also another program called the Student Democracy Program. And I think they have, I don't remember, but there's like, they've got hundreds of students, high school students, juniors and seniors that are going to be working at the vote centers. One of the things that those folks do is pretty much all the vote centers will have drop-off stations so that people who are just dropping off their ballot don't have to stand in line to go into the vote center. And those are usually staffed by the high school students. So yeah, my understanding is they were able to get enough folks.
Awesome. My other question was related to something that you mentioned in one of your first slides about people picking up ballots for people who might be disabled or homebound who cannot go. I'm assuming that the name of the individual dropping off that ballot has to be written down, and then at whatever place that's delivered, they will ask for ID. Am I correct? To verify on the name?
Yeah, I mean, they don't. So basically that's filled out by the person who voted. So essentially they would put down the name of the person that's returning the ballot. That person signs it. And then you have to say what your relationship is to the voter. Okay. But again, the ballot, the envelope should be sealed. And again, it is filled out by the person who voted. Right. And in California, it doesn't have to be a blood-related person dropping it off. The only restriction is you cannot pay someone, or they cannot get paid to pick up your ballot and deposit it. Thank you very much. Does anyone else have a question? Otherwise, we will move on to public comment. Okay, well, thank you for having me.
Thank you.
Yes, thank you. Do we have any public comment, Mitzi, on this item?
Hi, Chair. So for all those joining via online, we will now use the raise hand feature in order to organize any public comments. If you have a public comment, please raise your hand now. Chair, I do see that Rebecca has her hand raised. Rebecca, I will now start sharing the stopwatch, and once I start, please, I'll be able to unmute you, and then please commence your public comment. Chair, I believe she lowered her hand, so you can stop.
Very well.
And then I will turn it over to Victor. Victor, do you have anybody on your end?
Thanks, Mitzi. I'm not seeing anyone at this moment.
Thank you, Chair. Back to you.
Thank you both. We will move on to the next item on the agenda. We'll have a presentation on the pandemic affecting specifically the Latino community disproportionately. We will have this presentation by Deputy Health Chief Shrija Srinivasan.
Good evening. Can you hear me okay?
Yes.
Okay. Good evening, Chair Rodriguez, council members. Thank you for having me back. It has been several weeks since I last saw you, and many things have changed, I believe, and appreciate the opportunity to share with you the plan and the evolving learnings that our county health team shared with our Board of Supervisors not too long ago, a couple of weeks ago. And thank you, Mitzi, for queuing up the slides. So you could go to the first slide. So what we know over the many weeks and months of the pandemic is the impact of the virus's spread has not been borne equally. And you all know that as leaders in North Fair Oaks, where when the virus first got to the United States, I think many people thought maybe something in which we're all vulnerable might be an equalizing force. And what the virus has laid bare are the deep disproportionalities that are apparent in many health issues are actually being revealed even more strongly with COVID-19. And in this slide, what we look at are what is the representation of the population, which is the third column, labeled with our census, which we've, with Emma's leadership and probably a lot of participation for you all, have just concluded. But from the last census, you see the distribution of San Mateo County's population by race and ethnicity. Mm-hmm. And juxtapose that with the column just to the left, which is the distribution of COVID-19 cases. Mm-hmm. So most prominently in the top row, while the Latino population represents around 24% of San Mateo County's population, we see more than 52% cases. Of the 52% of the cases. And I'm sorry? Oh, I thought I heard something. What we see is that the distribution actually mirrors much more closely the distribution of the low-income population in San Mateo County. The right two columns show the distribution of the enrollment in public health insurance coverage. One column for the Medi-Cal program, which serves many low-income residents in San Mateo County, about 120,000 residents. And in the rightmost column, our ACE health coverage program, which serves residents who are not eligible for federal and state coverage, largely due to documentation status, in which 80% are Latino. So the point in displaying this distribution by race and ethnicity, looking comparatively at the population as a whole and the low-income population that relies on public coverage, is to just reinforce what we understand about the virus's impact on low-income residents and populations of color. These are the groups that have had the most exposure and been least protected from the virus having an impact. And the next slide, please. Every day we update on the County Health Dashboard. This slide is a snapshot from our dashboard from Tuesday. So since then, our cases are up a little bit. Our total cases this morning was 10,961. But we look at our cases by race and ethnicity. That's in the leftish part of the dashboard. And that, reflects in a slightly different way the column I just showed you in the slide before. And we also see other disproportionalities and demographic reflections of risk and exposure that we're learning through very closely monitoring the virus and trying to mitigate the spread, and always prioritizing our most vulnerable residents. For example, by age, the largest population that is affected is the 20 to 29 age group. And that's a population that, as we see who is exposed to other people, who is doing work on the front lines and unable to work from home, who might be engaged in the activities that keep a family fed. Our younger age group is quite impacted. And then on the right part of our dashboard, we look at the fatalities. San Mateo County has lost 157 residents to COVID-19. And when we look at the deaths, it is the white population that has had the greatest number of fatalities. So these first two slides were designed to reflect what we are understanding and continuing to see about what the virus has laid bare. The impacts have not been borne equitably. There are populations who are less protected that we have to keep supporting and protecting so that the inequities that preceded the virus do not get deepened as we keep trying to mitigate the virus's spread and protect those who are the most vulnerable. Next slide, please. The risk factors that underlie those demographic impacts, as I was mentioning, have a large amount of alignment with income and wealth factors, that the populations of color are overrepresented among our lower wage workforce. The Latino population, the Black population, the Pacific Islander population in San Mateo County have lower incomes. And many residents that are working in lower wage jobs also experience less protective benefits, not having access to paid leave or sick leave that allows one to prioritize our health when we have to choose between being able to pay rent, being able to assure food for our families. And that is a significant risk factor for people being able to isolate if they were exposed to the virus. And similarly, the factors that leave one exposed have to do with contact with people in other households, having the ability to remain 6 feet apart and to protect oneself through the proper protective equipment. And we see certain work sectors, what we've seen in San Mateo County through the last several months, are caregivers, those working in custodial or maintenance roles, those working in food service and construction have had greater exposure to the virus, which again tracks back to a higher burden on populations of color, where a UC Berkeley study found that about 43% of people doing frontline work are people of color. 60% of those at the lowest wage doing frontline work are people of color. And then when we unpack in our very expensive local housing market, often those who are at the lowest end of the economic spectrum are needing to make do with housing that is more crowded than ideal. And that too increases risk for impact from the virus because there's not enough space at home to distance from other members of one's household. There's not the ability to maintain separate bathrooms if one is exposed in the work setting or in another setting and then comes home and shares that space with several other family members. So altogether, these risk factors leave populations of color, low-income residents at higher risk and less protection from the effect of the virus. Next slide, please. Our local work to mitigate the virus is under an umbrella of a state framework. And I believe when I last met with you all, this blueprint for recovery framework had not yet been put into place. The state initially worked with counties through something called the monitoring list. And about 7-8 weeks ago, that shifted to a framework called the Blueprint for Recovery. And under this framework, every one of the 58 counties in California is assessed based on 3 metrics for how well the virus's spread is being mitigated. In the areas of the state in which the spread is the greatest, there's a tier assigned in a purple color code, the purple tier. And that has to do with a case rate that's at the higher end and a positivity rate. What proportion of people who are tested for COVID-19 end up positive, being at the higher end. The second tier is red, and that is termed substantial, slightly lower level of case rate and a lower level of positivity. The next tier below the substantial is orange, and it's moderate. And the lowest tier is yellow and minimal. The state introduced within these tiers something called a health equity metric, and that looks specifically at the positivity for the parts of the county that have had the lowest resources or lowest opportunities. Looking at the quartile of census tracts in which these factors that I mentioned in the last few slides, the opportunities have been the lowest. The risk factors that include being low income, living in overcrowded housing, working in an essential frontline job are more concentrated. So in addition to assuring every county's mitigation with regards to spread or the case rate and positivity, every county is accountable for assuring that the positivity is improving in the lowest resource census tracts, and not those census tracts are not being left behind. And that's the health equity metric that's listed within each tier definition under the positivity rate. So while there's one metric for the population as a whole in the county, there's a second metric which we'll touch on in a bit more detail in the next slide. But I wanted to just introduce how the state is holding every county accountable and the framework by which economic activity is able to open in any county. On the map, you will see that, there's quite a bit of variation across California. The widespread purple areas are more prevalent in the northern, or not northernmost, but north of us and Southern California counties, of course, very populated counties with denser populations. San Mateo County is currently with several Bay Area counties in the red tier. And you'll see in the Bay Area, there are more orange and red among the medium and populated counties. So Mitzi, if you go to the next slide, I'll dig into it just a slight bit more. Every Tuesday, the state releases the data as they see it, looking at the case rate, the positivity for the county as a whole, and our equity metric. So 2 days ago, on Tuesday the 20th, our data were showing a case rate that actually puts us in the orange tier. We're in the red tier right now because we would have to meet a tier's metrics for 2 consecutive weeks in order to be moved into that tier. Our positivity rate is actually at a level that's in the yellow tier, and our equity metric is at a level that's in the orange tier. So today, this week, we are meeting the metrics to move into the orange tier next Tuesday, should we be able to maintain this level of mitigation and spread. And to the right, on the San Mateo County map, which you saw as red in the slide previous, is a depiction of the highest, the equity metric census tracts. Those with the lowest resources are in the blue shaded area. I think you all likely have a good visual mapping of where North Fair Oaks sits in that blue area, that is your community. And these are the tracks in which we are prioritizing the strategies aimed at mitigating the disproportionate impact of the virus. And alongside this map on the right, the Office of Community Affairs team has delineated regions in which a group of community partners we are enlisting will be working with us, and I'll touch on that in just a bit. So next slide, please, Misty. Those factors affecting the spread of the virus are deep, and they've preceded the virus, and we're trying to keep them from exacerbating the virus's impact. At the same time, there are some things that we think we can have a more immediate impact on to blunt the risk that our Latino population, our low-income population, other populations of color are experiencing. So we see 4 key drivers that we believe we can have a shorter-term impact on, while we also continue to work on the long-term structural roots of inequity that the virus has laid bare. Number 1, we believe we can continue to make gains on the focus and adoption of protective behaviors. These are the things we all can do. And as community leaders, you likely are modeling these already, but facial coverings, washing our hands, maintaining that 6-foot physical distance, and avoiding gatherings. These are core behaviors that people talk about pandemic fatigue. Many people are getting very tired of having to do this, but we absolutely have to remain vigilant on these protective behaviors, and we feel like we can continue to reinforce that over the shorter term. A second key driver we know we need to keep working on is a lack of trust in us and government. We know that there are many reasons people come to trust or not trust government. People whose livelihood, whose citizenship, whose immigration status, whose legal status, and whose safety have been threatened by interactions with government leave them distrustful. And we know we have to keep working on ways that we can overcome that distrust. A third key area that we believe we can make progress on, and we actually have made a significant amount of progress even over the last 4 weeks, is access to testing that can be easily obtained for people who live in communities in which obtaining a test through a healthcare provider or through one's work is not accessible. And these are the communities in which that equity metric displays that the positivity is higher, and we need to keep working on making testing easily available. And then the fourth key driver we know we could keep making progress on in the shorter term are removing the barriers that prevent people from being able to safely isolate should they find themselves having been exposed as a close contact or positive for the virus. And we know that some people need extra support to be able to isolate for 14 days, to be able to self-quarantine. If a job is on the line or food is not going to get to one's family, we need to not make it so costly to isolate if we're going to expect people to adhere. So from those 4 risk factors, we have 2 key strategies that we are priority in our plan. And Mitzi, go back 1 slide because I think we breezed over it kind of quickly. The first has to do with communication and outreach. And the second has to do with how, in a culturally competent way, we mitigate the spread through the core public health measures. So I'll talk about each of those 2 strategies. On the first one, in terms of outreach and communication, next slide, please, Mitzi. We are so grateful for all we've learned through the census effort that we're concluding as the highest in the state through the leadership of the Office of Community Affairs. And we need to harness those learnings and expand culturally competent communication and public information in messages people can hear, through messengers residents can trust. And part of that is these core behaviors that I just mentioned that shouldn't sound like public health gobbledygook from a bureaucrat. It should be meaningful and trustful in ways that can be understood. In addition to billboards and bus shelters, we've partnered with several counties in the region in a youth-focused effort called Crushing the Curve. The right graphic is from that campaign. And it's been really heartening to see that many of the partners who have worked with the county on the census campaign are interested in being a part of the outreach and communications effort that the Office of Community Affairs is leading, and that there are also new partners that see a role that they could play in helping their community protect themselves and their loved ones in the face of COVID-19. Next slide, please. Within county health, around outreach, information, and ongoing learning, we have the Board of Supervisors support to appoint a public health equity officer by mid-November. And we're working on identifying who that individual could be to help assure accountability for equity in our mitigation approach as a public health team, and also these other strategies in which we're learning from people to keep being successful. Let me just log right back into my computer, which a second part of the public health approach is that the public health equity officer will be convening a specific advisory committee of Latina, Latinx residents to keep us understanding and grounded in the approach that the Latino population is bearing so significantly. And we will welcome your suggestions for people who might want to serve on that advisory committee. And then we also know that we have to keep reaching out. We've had several town halls and forums and focus groups and ways in which we can learn from residents who are being impacted, from families and communities who are being impacted. What are the barriers? What is confusing? What could work to more trustfully assure reach and understanding? In addition to a forum that we held in mid-September focused on resilience with our Office of Diversity and Equity and Star Vista, soon you will be receiving a piece of mail. You see profiled here at the bottom from a nurse practitioner who works at our Fair Oaks Health Center, Rebecca Guzman, a picture of her beautiful family, telling her story of her own family's compromises that they were making as young children and elders living close together had to make some different decisions about themselves and protecting each other through the virus. So that is in the mail. I think within 2 to 3 days, Fair Oaks residents will be receiving that letter from nurse practitioner Guzman, which we appreciate her contributions. So the second key strategy, next slide, please, is about the way that we do the public health mitigation. And there are 3 key aspects of that. The first has to do with testing and assuring low barrier access for at-risk populations. And I really want to express gratitude to Justin Mates, who joins you in these meetings and leads on so many fronts, but he has partnered really closely with the public health team and many community partners to mobilize a range of strategies that can assure every neighborhood that has been the most impacted and has had the highest positivity has ways to sponsor testing right in the neighborhood, easily accessible at no cost. Also, supporting other strategies in which testing could follow any cluster that might be emerging, and linking that testing to the outreach and education that can help anyone who comes to be tested understand how can they keep protecting themselves, how can they keep protecting their loved ones. We've increased our testing by more than 50% in the last 4 weeks through this range of strategies, trying to normalize the importance of getting tested if you have any concern, that to normalize, that if you think you've been exposed, there is testing that can be close to you and accessible to you. The second of the 3 has to do with case and contact investigation. This is a research-based public health approach that's used in many communicable diseases. And we as a public health team welcomed about 80 new colleagues from departments across the county, so that we have a contact tracing workforce of 115 individuals, 48% of whom are bilingual. The largest language capacity is Spanish. And we are able to keep up with every new case assigned within 1 business day, so we can provide early support and guidance to anybody who finds that they are positive. And then the third is a very individualized wraparound support for anybody who's having barriers safely isolating. So the next slide, please, Mitzi. Through a partnership and a contract with a longstanding nonprofit organization in San Mateo County, the Mental Health Association, they have now received more than 500 referrals representing 2,400 individuals of people who, isolating for 14 days is just very, very daunting. And the specific types of support that we're able to provide include, for some, it's alternative housing. There are hotels in each Redwood City and South San Francisco in which someone can be housed and have 3 meals and be able to separate so that the rest of the household can be safe at home and a person can recuperate safely in an alternative housing site. For some, it's delivering groceries and making sure that no one if the person who tested positive is the one who's typically doing the grocery shopping or the meal preparation. How do we make sure that food security is not an issue? For some, it's a brass tacks economic support. People who are losing pay when they have to isolate could receive up to $1,200 for the 2 weeks in which they isolate. People could receive support to pay 1 month of rent. And for some people, they've lapsed in their health insurance coverage. They don't have health insurance coverage. There are symptoms they're experiencing and need to connect with a doctor. These are the kinds of things that the Public Health Support Program is providing to the 500 people or 2,400 individuals who have needed some extra support to isolate. And by doing this, we hope we can also reinforce for each aspect of our public health mitigation, whether it's seeking a test or returning the call from a contact tracer, we would love your help in reinforcing. Please pick up that call. Please call the person back. Please get the test, because if you learn you're positive, support will be provided. There's support available. We want to assure any resident who's feeling the fear of exposure that the barriers that you might be afraid of can be mitigated. Next slide, please. So as I close, I wouldn't be a good public health representative without also making sure, in addition to voting, a very important action you can each take and help us model is getting your flu shot. We're very intentional about preventing a twindemic, the flu, from colliding with what we're trying to mitigate with the pandemic. And there are free flu shots available throughout the North Fair Oaks area through multiple channels. You may have heard that Kaiser is offering free flu shots not only to members, but also non-members, including a drive-through location at one of its Redwood City locations. For patients of the Fair Oaks Health Center, the San Mateo Medical Center is offering flu shots there. And we request that people make an appointment. And we also have a drive-through clinic scheduled on November 7th. But there's plenty of availability, pediatric and adults. And so any patient, we hope, would not have any barriers getting a flu shot at the Fair Oaks Health Center. And then through our broader community-wide support of flu shots, our mobile van is scheduled on Tuesdays at Fair Oaks Health Center, 9 a.m. to 1 p.m. And then also, Fair Oaks Community Center. And then also Wednesdays, noon to 6:30 at 5th Avenue and Spring Street. There are multiple other venues through pharmacies, CVS, Walgreens, Costco. And we haven't heard any issues of supply of flu shots being a barrier. So really encourage all of you to please take that action as well. I believe you had some questions about the COVID vaccine, and I hope you heard that California submitted its COVID vaccine preparation plan last Friday, October 16th. The county informed that plan and is very actively monitoring what is going on with the development of a safe and effective vaccine. California will have a separate scientific advisory panel to assure the safety of any vaccine before it's delivered to any resident of California. And then we're all waiting to hear which vaccine with which priority populations and by when, so that we can assure robust protection when a safe and effective vaccine is available. So I took a fair amount of time, but I want to also make sure there's plenty of time for your questions, which I'm happy to engage with you on.
Thank you very much, Dr. Srinivasan, for your time, your thorough presentation, and I'm sure council members will have any questions. Council members, you can raise your hand and we'll proceed to your questions. I can get started with one question while other council members think of their questions or raise their hands. And so in looking at the data that is provided by San Mateo County, there's a couple of things that that have puzzled me. One is that for several months, the number of cases by city has remained at 10 cases. And anecdotally, I have heard of easily more than 10 people, not only from folks around North Fair Oaks, but also from community-based organizations. So I'm wondering why the number remains there, if it's a matter of an update or if it's something that has not been fully identified.
Yeah, thank you for that good question. I had a little preview of that question, and what I understand, first of all, the data are updated weekly. So the total number and the distribution of the cases is being regularly updated, and we don't see huge anomalies we have a little bit of underreporting with one lab, but we believe that the overall data is accurate. But I believe what we understand is when a case gets attributed back to its residents, we have to have complete data on the street address in addition to the zip code to place it back correctly to North Fair Oaks. And because North Fair Oaks shares a zip code with each Redwood City and Menlo Park, our epidemiologists believe there could be a fair amount of noise in cases that are showing as Redwood City, which should be properly attributed to North Fair Oaks. And earlier this week, they thought it would require some different kind of spatial analysis. I'm not an epidemiologist, although I want to be one, to more accurately separate cases that may be showing in either Menlo Park or Redwood City that should be in North Fair Oaks. So there's a live question to that team about how long would it take to have a different method? And just to give you one more level of detail, unfortunately, many elements of lab tests data are missing. The demographics are missing. So you might have seen 22% of our test results don't have race or ethnicity. We have we might have the zip code, but not the street address. So when we have missing elements in the lab data, we aren't able to accurately reflect back your community's representation, but it is on our radar screen, and I'm happy to report back to you as they figure out how long it will take to attribute those back.
Thank you. The other part of the data that also made me think about the implications of jurisdictions, different jurisdictions, was the fact that some of those cases that I've heard of ended up being attended at the Stanford Hospital, which is in the county of Santa Clara under that jurisdiction. So I was wondering if, for example, a resident of North Fair Oaks turns out to have COVID-19 and for whatever reason is sent to the Stanford Hospital or any other hospital in, I don't know, San Francisco and another county, does that particular case count in the county of San Mateo, or does it count in the county where the hospital is attending that patient?
There should be no barrier if it's an out-of-county hospital in that data being reflected in our data. The data for our residents always gets attributed back to our county. And frankly, any case that ends up in a hospital, we have very complete information because there's a bunch of other healthcare activities that are going on so that we have very complete demographic data for those cases. The cases that we have less complete information are usually people who aren't interacting with the healthcare system. Their health record is incomplete. The doctor who ordered the test or a community testing site like the Verily site or a community, a curative site, we might not have all the demographics. But Stanford Hospital, there should not be any barrier in that data being reflected accurately in San Mateo County's dashboard.
Great, thank you. Are there any questions from other council members?
I have a question.
Go ahead, Beatrice.
When we talk about testing and you have gotten your test, is there like a cycle to get retested if you, just because of your ins and outs in at work, to get retested on maybe a month, not monthly, but have you thought about those that have been tested? And once it's I guess my question is, once you get tested, do you ever go back and get retested at like a couple of months later?
Yeah, it's a good question. For most regular cadences, there are only a few sectors in which a schedule has been set.
Oh, okay.
For example, school personnel, as some schools consider moving back to in-person instruction, the recommendation is teachers and staff would be tested monthly. Right. People who work in a nursing home or a long-term care facility, they need to be tested regularly because there's high contact, high exposure. Most other professions, there has not been a public health recommendation for how often one should get tested. Now, if you were symptomatic or you had exposure, the case and contact investigator might recommend a repeat test or your doctor might recommend a repeat test. But most professions don't have that same regular cadence. Some employers and even some professional sports teams, require it, but not for most other groups who are not working in a healthcare setting or a congregate care setting or schools.
Another observation that I've made is I see a concern where there's still this sense of people visiting each other in large crowds, and that's very concerning because I'm seeing still a lot of house parties, birthday parties, anniversaries, where there's 20 plus people in the front yard, not social distancing, not wearing masks. And it's very, very worrisome, and it's a big concern.
The gatherings continue to be a vector of spread. And one of the other contributors to the 20 to 29 age group are a lot of gatherings. It's a group where people like to socialize. So we could use any advice that you want to offer us of how to reinforce the messaging around the risk of gatherings. I think there are also different points of view of a harm reduction approach in terms of outdoor is better than indoor, shorter duration is better than longer duration. But if we can all wear a mask and we can all stay 6 feet apart, that is safer than, multiple households and large gatherings. Now, the state of California did issue specific guidance that personal gatherings should not include members of more than 3 households. So when you see 30 people, 50 people, birthday parties, other gatherings that doesn't look like it's only 3 households. That is the public health, recommendation that is not safe. It persists, and we need, all kinds of influencers to change those norms. It is not safe. And that is one thing the health officer has reinforced in every statement he's made. Many of the roots and barriers are systemic and very difficult, but the gatherings we can do something about. So we need everyone's participation to avoid the gatherings.
Thank you.
Thank you very much. Linda has her hand raised. Go ahead, Linda. This will be the last question.
Okay. I think you got a lot of the different areas covered with your mitigation plan. What is going on with employers that employ the low wage workers?
Yeah, thank you.
Because there's a lot, I'm sorry, there's a lot of stuff going on in the neighborhoods, a lot of landscaping, a lot of yard work, a lot of construction. It's like people are going crazy, doing all kinds of things. So that's another area, though, that will need to be looked at.
Yeah,
and I'm not sure how to do it.
I'll mention the 3 prongs that are currently underway. So first of all, one of our targeted outreach channels is 2 small employers with influencers who are employers talking to their fellow employers, a restaurant owner or a construction manager, or enlisting people who can be influential employer to employer from an outreach standpoint. And the Board of Supervisors did allocate some resources to bolster that effort on Tuesday that we think can be helpful. Number 2, there is some targeted in-person outreach to the employers located in those geographic areas, the lower income areas, to help them understand the role they can play and the behaviors that we need their help with, both with their employees and with their customers. Our first priority are food establishments, just because of the ripple effect and the risk. But you mentioned construction and you mentioned landscapers. There are other sectors that after food establishments, should there be capacity, we would look to. And then the third prong is frankly enforcement. And we did, through the county manager's leadership, stand up an enforcement unit so that if there are citizen constituent complaints about repeat violators who are businesses, we now have a team that will go out. We start first with education, making sure people understand, but if there's repeat violations, they will go out, they'll talk to the business owner, they'll warn the business owner, and then there is a progressive process that could involve fines, civil penalties, and even criminal penalties if there's wanton disregard for the public's health. So those are what we're mobilizing. And we'll, of course, if there were an outbreak in any setting, the public health team would jump on that to try to break the chain of transmission.
And would the public health department work with employers to upgrade how they're targeting their own people, such as doing thermometers? I've talked to a couple of people that were before they even go into the work site, the bosses.
Yeah, the symptom checking.
Right. Actually, to what extent would you allow that?
We really recommend symptom checking and screening for employers that are bringing people to the workplace. And we have a toolkit that we walk people through. I think for some smaller businesses, for minority-owned businesses in which information is not being received in their language, or it's been really difficult to access, they might be starting at a different place of understanding, like, oh, okay, I have to do this, this, and this, and you're expecting me to do that, and are there resources to help me? There is a prong of the San Mateo Strong Fund that's targeted to small employers that was augmented with the board's investment on Tuesday. Mm-hmm. And then if there were a cluster of cases at an employer location, then our public health team would be reinforcing that education and guidance. Like, look, this is what we saw here. You know, this is what appears to have happened. We want to work with you so you have a plan in place so that that does not happen again.
Thank you.
Thank you again for your presentation, Dr. Srinivasan.
I'm not even a doctor, so speech is just
Oh.
fine. Nice to see you all.
You sound like
Yes. Okay, Deputy Health Chief. Thank you. Mitzi, do we have any public comments?
Yes, Chair. So for all those attending the meeting on Zoom via video conference, right now we will use the raise hand feature in order to organize any public comment. If you have a public comment, please raise your hand now. Chair, it seems that we do have a public comment. Graciela, I apologize, Gabriela. I will now unmute you. Please wait until the timer starts in order to speak.
Can you hear me?
Yes.
Okay, thank you. Thank you very much. As I mentioned before, I'm a long-term resident of North Fair Oaks. And in addition to being a long-term resident, I'm also a nurse practitioner and I work at Fair Oaks Health Center. And for those who don't know where that is, it's the clinic on Middlefield Road by the old train tracks. And as Mrs. Srinivasan mentioned, increasing the access to COVID testing is really important. I believe that one way that we can increase testing among the Latinx population is to remove all the barriers that are there for the testing. I know that some of the testing locations are still requiring an email or a web application. And then some locations are still, the appointment is being driven by whether the patient or the individual has symptoms or no symptoms. And I think it would be great to be able to remove those barriers and enable anybody that wants to be tested in a timely fashion, especially because we have a lot of residents that live with large number of other people, either family or non-family. So whatever we can do as a community to encourage those providing those testing to remove those barriers, I think the more people we will have getting tested. I do have a question for Mrs. Srinivasan. She mentioned the public health support program for financial assistance during isolation period, and I'm wondering if residents can self-refer to that. And then just one last comment is about the lack of accuracy on the San Mateo County dashboard. I'm concerned about the lack of accuracy because I'm concerned that will somehow correlate to a disproportionate services and attention being paid to our community. So anything that we can do to improve the accuracy, I think will help North Fair Oaks, given that North Fair Oaks has been historically underrepresented. Thank you.
Thank you. Go ahead, Mitzi.
Through the chair, I will now check. There's no other hands raised. I will now check in with Victor to see if there's any hands raised.
Thank you, Mitzi. I'm not seeing any at the moment.
Thank you, Victor. Back to you, Chair.
Thanks very much. Unfortunately, in the interest of time, we still have two more presentations. We will have to move on, but this is certainly a topic that we will continue revisiting as the pandemic progresses. But thanks again. And then also an apology because I intermix the item presentations. So number 4 was supposed to be what now turns out to be number 5, a presentation on the COVID-19 San Mateo County Recovery Plan. I apologize. I got an older version of the agenda, which had those items reversed So all my fault. But so this presentation for the COVID-19 San Mateo County Recovery Plan will be given to us by Peggy Jensen, Deputy County Manager, and by Danielle Lee, Assistant Director of for the Office of Sustainability, and also Jessica Mullen, Resource Conservation Program Manager. Thank you, all three. I think you're muted, Danielle. I'm sorry. I think you were muted.
Yeah, give me a quick second.
Can you hear me?
Yeah.
Okay. I was just noting that it appears that Peggy Jensen may have some connection problem.
Okay.
So I'm happy to get us started. And then once she's able to join us, she can jump on in.
Sounds good. Thank you.
Sure. Good evening, Chair Rodriguez and members of the council. We're really pleased to be here this evening to talk to you about the San Mateo County Recovery Initiative. Our goal is really to create a better future through collaboration, advancing equity and inclusion. And the Recovery Initiative is a collaboration of many people. It's not just a county plan, it's really a county-wide plan. Local government agencies, community-based organizations, nonprofits, and private partners have all been included. If we could go to the next slide. There were 168 members that participated in the Recovery Initiative. I think I mentioned some of the representatives. The plan focuses in 4 main areas: public health, equity, fiscal responsibility, and community collaboration. They're the 4 pillars, if you will, of the Recovery Initiative. If we can go to the next slide. How did we engage the community? We spent quite a bit of effort from April through the present in terms of community workshops, interviews with community leaders, having community members review the strategic plan. Once the strategic plan was developed, we had work groups, and there were over 40 meetings of those work groups, and over 150 committee members were convened. And then we had additional presentations to stakeholder groups to provide additional feedback. If we can go to the next slide. And one of the core tenets of the plan, the foundational pillars, if you will, is the goal of advancing equity. We had an equity recovery group that convened very early on in the Recovery Initiative process. And one of the first things that we did was to develop an equity guiding statement, which is before you now. And they also helped us think through how to actually operationalize that. So how to take into account equity in terms of the decision-making and solutions that were proposed, the data that we use to make those decisions, understanding who's burdened by various recommendations, as well as who benefits by them. And then finally, how do we keep ourselves accountable? How do we keep communication open with the community? So we can go to the next slide. So a lot of the work of the Recovery Initiative during the development of this implementation plan was to understand where the need is. If you could click through once. We know that 65% of COVID cases are affecting residents of color and ethnic minorities. We just had a long discussion with Srija about this very topic. Click through again. Over 10,000 immigrants have received $1,000 each in financial assistance through the Immigrant Relief Fund. We've seen a 250% increase in food distribution by Second Harvest. And then we also see that small businesses are struggling. Over 600 small businesses have applied to the various programs that we have implemented for financial assistance. On the remote learning side, we've seen that over 4,000 students lack Wi-Fi and tools for distance learning. And then in terms of employees, over 20,000 low-income workers have lost their jobs since the beginning of the pandemic. Go to the next slide. We know that our path to recovery must address the critical and immediate needs, but it has to do much more than that. We also have to build and create community capacity to respond to these changing conditions and to build back consumer confidence so that people will return to, frequenting businesses so that we will be able to eventually reopen the economy. And then finally, we don't just want to go on a path to return back to where we came from. What we really want is to build a better future. So how do we use the pandemic and all of the investments that will have been made towards recovery? How do we use those in a way that builds us towards a better future, somewhere beyond where we came from? Next slide, please. And what does the timeline for recovery look like? We ask ourselves this quite a lot. We know that in terms of immediate response, to addressing those critical needs, there was an immediate spike at the beginning of this year when the pandemic started locally. We don't see that as dropping off immediately or smoothly. We anticipate that there will be future peaks in demand and in need, really, for support. And then if you could click once more. At the same time that we're dealing with the immediate and critical needs that we see in the community, we've also had to start thinking about midterm recovery. So how do we create community capacity? How do we start to build back consumer confidence? And if you could click once more. And the long term, how do we build towards that better future? That work too must start now. We won't be able to get there if we don't start thinking and planning for those future goals. Next slide. I just want to take a moment to acknowledge that pre-COVID, there were many inequities, many conditions were already difficult for our community members. If we think about the COVID-19 response, of course, pre-COVID, there was work around public health preparedness and there were health disparities. Not everyone was universally experiencing good health. Some communities suffered poor health outcomes on average. In terms of housing, it was limited and expensive. Childcare as well, expensive, limited options. It was difficult for families to secure childcare. In terms of connectivity, the digital divide certainly existed. It may not have been quite as exacerbated as it has been during the pandemic. And then finally, in terms of economic recovery, there was low unemployment for the county overall, but there were gaps for small businesses, gaps for some subsets of the population. Not all communities experienced that low unemployment that we saw at the countywide level. So what has our response looked like? For short term, the health response was to issue these shelter-in-place orders. Everyone moved and retracted into their homes. For housing, rental assistance and eviction protections were enacted fairly quickly. Childcare centers were able to get local grants and federal loans to stay afloat financially. And students were able to get hotspots and laptops from their schools, primarily from libraries as well. And then small businesses were also able to get local grants and federal loans. In terms of the midterm responses that we've either started to implement or are contemplating, there has been a significant deployment of COVID support for individuals and their families who are afflicted by COVID. And then we are also embarking on expanding mental health outreach as well. We know that the mental health toll of the pandemic is considerable. In terms of housing, rent and lease negotiations and other supports to tenants and to property owners are being deployed. Childcare facilities are getting technical assistance and other assistance. And then in terms of the connectivity issue, Wi-Fi has been expanded. We've embarked on several pilot projects where we're bringing Wi-Fi to a kind of a neighborhood scale. Rather than giving out hotspots one by one, we're looking at opportunities to bring connectivity to neighborhoods, a couple blocks at a time, larger clusters than individual houses. And then for economic recovery businesses, we're working on deploying out additional business grants, but also support businesses. And then also looking at job training. How do we help prepare the workforce for post-COVID jobs? And then finally, in terms of the long-term recovery, our goals are really a healthy reopening and greater health equity. For housing, we're looking to have a community where affordable housing meets the needs of the community. And the quality and affordable childcare is available to families, and the internet is available for all residents. And then finally, we're looking for a robust economy with low unemployment for all. And with that, I'll hand it over to my colleague, Jessica.
Great, thank you, Danielle. So in terms of the response and the recovery, we want to walk you through a number of programs and investments that have been currently made during the short-term and midterm phases of the recovery initiative. Can we go to our next slide? In regards to funding, the recovery programs that have been implemented, over $66 million in a variety of funding sources have been distributed through various programs to help our most vulnerable communities, nonprofits, small businesses, and children during this time. Over 2/3 of the funding has been dedicated to serving our vulnerable communities by providing services and assistance related to food, housing, and immigrant assistance. The additional third of the funds have been committed to help small businesses, nonprofits, community-based organizations through various programs like the SMC Strong Fund, as well as to childcare grants, to childcare providers, investments in bridging the digital divide so that children, businesses, and residents can thrive in a virtual environment, and to our COVID-19 outreach, including working with our PIOs in all the cities, as well as our equity group to develop culturally and linguistically accessible messaging. So we can go to our next slide. From these programs, we have, and through these commitments, we've been able to stand up programs to really meet our basic needs. We know that for housing, we have over 23,000 extremely low renters throughout the county, as well as over 4,000 requests for emergency and financial assistance. To provide assistance to our vulnerable populations, the county has committed funds to help renters, establish a small property owner program, and the immigrant assistance program. Through these programs and the funding committed by the county, we've been able to leverage additional funds and contributions to provide assistance to more of our community members. We'll go to our next slide. Additionally, as Danielle mentioned, we've seen a 250% increase in food provided by the Second Harvest Food Bank. The county is addressing this need through programs such as the school lunch program, which provides meals to students during the shelter-in-place ordinance, as well as through Second Harvest Food Bank and the Great Plates Delivered program, which not only provides food to our seniors, but it also serves as an economic recovery program to assist our local restaurants. If you go to our next slide. In regards to meeting our digital divide, we know that we have over 26,000 households without Wi-Fi in the county, and 4,400 children are reporting Wi-Fi issues. The county is partnering with the San Mateo County Office of Education to launch a pilot program that will provide free public Wi-Fi and technology hardware such as laptops and hotspots to 2,700 students in 6 communities to really target those areas in need throughout the county. Go to our next slide. Additionally, in regards to our local economy, as Danielle mentioned, we've lost over 20,000 low-income jobs. Our unemployment rate is at 9.2%, and we have 268 known business closures. To provide assistance to our local businesses and workers, the county has launched the SMC Strong Fund, has partnered with the Renaissance Entrepreneurial Center to provide $2.5 million in grants and assistance to geographically targeted businesses, and is partnering with NOVA, which is our local workforce investment board, to provide employment assistance programs throughout the county. We can go to our next slide. And I will turn it over to Peggy Jensen to talk about how we will move forward through the rest of the initiative. Peggy? think, is she still?
Yeah.
Can you
Okay,
go
that's
back
fine.
to the last slide? You were kind of quick on moving slides. Can we just look at the last one, please? Thank you.
So these are the programs that we have currently been able to stand up. We are working with NOVA to look at other supported, launching a strategic planning session to really look at our job market intelligence to identify where the current and future needs for jobs will be and identify standing up additional employment support programs to develop career paths for our job seekers in our county. And we can go to our next slide. So as we move forward, we want to sort of identify how we'll implement these recommendations, track the progress, and really engage the community. We know that the initiative work plan is sort of responding to the needs that we have now and sort of ways in which we can be responsive and to new and future needs that may emerge during the pandemic. Can we go forward? Mitzi, if you want to just, click through all for each of these sort of 6 focus areas, the county is really partnering with a variety of community partners to be able to stand up services, think through creative responses, and really provide the services needed for our community going forward. We can go to our next slide. So through working with our implementation partners, we'll really work on how to build out those response programs. Additionally, the implementation groups will really identify where the gaps are, assess the needs, evaluate current progress, and really see if there are other opportunities in which we can partner and leverage additional resources as we transition through the different phases of the pandemic. From there, we'll also develop a collaborative work plan to fill out the gaps and needs that will additionally identify our resources, look at additional funding options, working with public and private sectors to identify additional creative options going forward, and then really looking at how we can take action and track the progress so that the response is really meeting the needs within the community. We can go to our next slide. So to be able to track and share out progress on the recovery initiative, we have launched our recovery initiative website, smcrecovery.org. And through the various websites, for our next slide, you will see that we have information about how you can learn more about our recovery. If we go to our next slide. On our Learn More page, it sort of walks through the 9 different focus areas and identifies the recommendations and strategies within each area. You can go to our next slide. Additionally, you'll be able to sort of break down, we have a data dashboard for the individual areas, which will allow you to sort of drill deeper into the current needs and identify the programs that have been stood up and the services that are being provided. Can we go to our next slide? And then as you can see, sort of within the indicators, there are various ways to track the progress being made through this program. I think Mitzi can, kind of click through the different data points there. Thank you. And then go to our last slide. And then from there, for folks who want to continue to be updated or join one of the implementation groups, we have a Join Us page where people can sign up to get involved or to stay updated as well. And go to our last slide. And with that, if you have any questions, we would be happy to answer them now. Additionally, you can email Peggy, our Deputy County Manager, Peggy Jensen, Danielle Lee, or myself if you have additional questions or would like additional information.
Thank you very much, Jessica and Danielle, for your presentation. At this time, I'll invite council members' questions. If you have any, please go ahead. You can raise your hand or just come on up.
I had a question about I think it was that page I asked you to go back to, where it showed, for example, the amount of money for Renaissance.
Right.
Or it kind of breaks down
That one, I think.
Percentages. Yeah. Are these one-year contracts? That's my question.
No, they're essentially grants. But, oh, you mean contracts to the organizations that will be implementing them?
Yeah.
Many of them are CARES Act funded, so there will be an accelerated push to get these funds out into the community before the end of this calendar year.
And then at that time, you'll assess whether or not they continue. That may be a possibility. Is that correct?
Yeah, it's hard to know what would come after the first of the year. We don't know if there'll be another issuance of CARES money.
Okay. Thank you.
Yeah. Sure.
I don't see any other hands raised. Mitzi, is there any public comment?
For those attending this meeting on Zoom video conference, we will now use the raise hand feature in order to organize any public comment. If you have a public comment, please raise your hand now. Chair, there seems to be a public comment. Gabriela, I will start the timer, and once I do, I will unmute you and then you're able to speak. Gabriela, you're able to speak now.
Sorry, I forgot to lower my hand. I did not mean to make a comment. Thank you.
Thank you, Gabriela. Chair, now I will turn it over to Victor. Victor, is there any public comment on your end?
Thank you, Mitzi. There is none.
Thank you. Back to you, Chair.
Great. Thank you again for your presentation. And we will go on to the next item and the last on the agenda. That'll be a presentation on the tree planting project in North Fair Oaks. We will have this presentation by Maya Briones, Community Forestry Coordinator for Canopy. Go ahead, Maya.
Mitzi, is it okay if I share my screen?
Yes, go ahead.
Okay. Can everybody see that?
Mm-hmm.
Okay. I don't have a presentation for you all. This is the only visual. I'm mostly just going to share real briefly, because I'm sure we all want to get out of here on time, an update on Canopy's progress planting trees in North Fair Oaks. As a refresher, Canopy is an urban forestry nonprofit here in the Mid-Peninsula. We plant and care for trees for free for residents in the Mid-Peninsula in communities where they are needed most. My job as a planting manager, a forestry coordinator, is to organize community tree plantings in East Palo Alto, Bellhaven, and most recently North Fair Oaks. And so we plant free trees and we care for these trees for 3 years for free for residents in these communities on private property. And we do this with funding from CAL FIRE. It's really important to us that communities that are going to be more heavily impacted by the effects of climate change, such as extreme heat, which has a variety of health impacts, as well as storms and high energy usage, air pollution, all of these things. We believe that through the medium of trees and healthy green spaces, we can mitigate some of these impacts and make communities more climate resilient and also have a positive impact on community health. And so Canopy we had our first tree planting in North Fair Oaks in September. This planting had originally been scheduled for March, but we had to postpone due to the pandemic outbreak. And since then, we've established a safety protocol manual that allows us to return to field work safely and so that we can still plant trees for residents in these communities. And so our first tree planting went really well. We planted 11 trees. and for on private property in North Fair Oaks. And we are currently planning for a December planting on December 19th in partnership with the Siena Youth Center. That's the neighborhood that we are targeting for this planting. So anyone in walking distance of the Siena Youth Center could be eligible to receive a tree at that planting. Again, Canopy comes and plants the trees for free. We also purchase the trees so that resident doesn't have to. And we ensure that all utilities there's no conflict with utilities or any kind of damage to resident property. And so we're partnering with Climate Ready North Fair Oaks on this planting, which is an organization, a conglomerate of a bunch of different people representing interests in North Fair Oaks, ranging from the county to some council members here and other nonprofits, and as well as Stanford students and professors. And so we're working on doing outreach for this planting in December. And has entailed applying for Measure K funding to help support some incentives for this planting program. We're very blessed to have been given some funding for Measure K, which we are going to put towards outreach in the community, sending postcards and designing outreach materials so that we can reach as many people possible for this free program. And the funding can also go towards a financial incentive program. While the program is free already, we understand that taking on a tree can still be a bit intimidating, and it's not our intention to ever burden anyone with taking care of a tree. So what we're doing with this funding is purchasing some gift cards to a local gardening store, which has not been selected yet, that certain residents may be eligible to receive if they accept a tree on their property, if they agree to steward a free tree on their property. And so we hope that this incentive will help alleviate any other concerns that residents may have with the free trees program. And we're looking forward to the planting. I think that's it I have. I'm open to any questions. Thank you.
Thank you, Maya. It's great having you here. And I'm sorry it was short notice for you to come on board, but thank you for joining us tonight.
Absolutely.
In the interest of time, I would ask council members if they can refer questions directly to Maya. You can see her information, email, and phone number on the screen. We only have about 10 minutes to rush through what's next on the agenda, the reports. I only wanted to ask if there's any public comment, Itzi, on this item.
For those attending the meeting via Zoom conference, please raise your hand now in order to organize any public comments. There's no public comments on this end. Chair, I will turn it over to Victor.
Thanks, Mitzi. I don't see any comments either.
Thank you, Victor. Back to you, Chair.
Thanks very much. Thank you again, Maya.
Yep, thank you.
We'll go on. Is there any supervisors report?
Through the chair, good evening, everyone. Maggie Conejo had a conflict, was not able to attend tonight, so there's no supervisor's report.
Thank you. Do we have any managers report?
Yes, good evening, Justin Mates, Deputy County Manager, through the chair. Just a couple of brief items. Member Esser attended the neighborhood response team meeting last week. Not a whole ton that I will report on that, and I don't know if Member Esser might have some additional comments, but one thing that is apparent, and is probably apparent to all you all, that there's an increase in illegal dumping happening right now in North Fair Oaks, and what's clear, it's not limited to North Fair Oaks. It's a county-wide issue. We're seeing it, and in talking to the cities, they're seeing more of it too. Not sure if it has something to do with people just being home so much with the pandemic and wanting to, clear things out. But it's something that we're all trying to confront. For now, we're trying to get better outreach and have people understand that there are bulky item pickups available to take those large items. So something that we're monitoring closely and trying to work through on that. I'm sorry, was there a question?
No, go ahead.
The other thing, a couple of things that I heard during the meeting that I just wanted to let folks know about. Heard the public comment regarding notice about this council's agenda. I did want to just point out for all of you, and please spread the word that residents can sign up for notices about the meeting. It's on the council's website. There's a button on the left-hand side. Oh, good. I think Emma might have put it in the chat to subscribe. And if residents want to subscribe, they'll get the agenda that way. We don't have a very large list there. And so I think it may be that residents may not know that they can sign up. So we'll work on ways to get that message out and kind of re-promote it so folks know that they can sign up to get notices and agendas about this meeting. The other thing I just wanted to point out was with respect to testing and some of the comments about testing. We do have many new testing options in the county. One of them is now for children at the event center. We have a testing that they can test children and families and children as young as 5 years old. And so that's a new resource. We've been hearing a lot from the community. They would like testing options for their children. And the information on that can be accessed through the county's testing portal, which is smcgov.org/testing. Also, you may have seen we are trying to do more testing in North Fair Oaks specifically, in addition to the rotating site that comes to the Stanford parking lot every few weeks. We've had a couple of neighborhood sites. Redwood City ran a site at the parking lot of 2500 Middlefield. Casa Circulo ran a testing site a couple of Saturdays ago, and we're working with Casa Circulo to hopefully run some additional sites in the future. So please keep your eyes open for that, but definitely understand that we need more testing in North Fair Oaks and accessible testing. Also, Redwood City, we're working to try to get that, lower those barriers and access to testing. And with that, I'll stop talking so we can hopefully finish the meeting on time.
Thank you very much, Justin. We'll go on to, well, actually, there's a little bit of time if council members have any questions for
I sent
county managers.
I sent a question to you, Justin.
Sure, I see it. Member Lopez, what do you mean by what percentage of time?
Well, is there still one code enforcement officer?
Oh, yes, it's about code enforcement. Yeah, so we have, unfortunately.
What percentage is spent with NFO?
I don't have a percentage of time right now. We are still understaffed in our code enforcement office. We have in process a recruitment for, I think, 3 or 4 new officers because we just have faced a number of challenges there with folks retiring, folks going other places, folks starting and then going on leave. We just have had some challenges keeping that office fully staffed, but we have some active recruitments going on right now because we recognize that it is an understaffed office. I don't have a percentage of time right now, but I will get more information on that at our next neighborhood response team meeting and report back.
And one follow-up question, Justin. Can council next year get a report back on cases, open cases and pending cases and closed cases from code enforcement?
Code violations?
Yeah.
Sure, I'll look into that.
All right, thank you.
Thank you both. And just briefly, I'm going to read something that I believe Emma posted in regards also to, in addition to subscribing to the notifications from county about the North Fair Oaks Community Council's monthly meetings. There's also a note in regards to a COVID newsletter where you can visit the COVID resources page and subscribe to receive a copy of the COVID electronic newsletter, which is available both in English and Spanish. And you can visit smcgov.org. And every resident in North Fair Oaks is mailed the monthly newsletter. Thank you, Emma. Also, I think some of the comments from first comments from residents were in regards of having been already in the list, but somehow they were dropped and stopped receiving those. So I know there was a big transition from website to website from the North Fair Oaks Forward onto a new iteration that the county has now, and probably something happened during that transition. But again, if you want to subscribe, please visit the county's website and subscribe again. The information is in the chat section. You can copy it from there. Are there any council members' reports?
Yeah, Ever, I could add a little more color to the NRT meeting. I had a question on the NFO forward transition. I was just out there yesterday looking at it, and there is a calendar function on there. I thought perhaps we could put notification of our meetings on NFO forward, assuming the URL hasn't changed, because I looked at the calendar and there's nothing on there right now. I don't know who maintains that or whatever, but it seems like a great place for community information.
Right. Yeah, I think we can write this down under on our to-do list for our next study session and talk about that.
That would be great.
But thanks very much for attending the NRT meeting, Brooks. We'll appreciate your report on that.
Okay, let me go through some notes. I don't want to be redundant with some of the other topics that have been heard. As far as COVID testing, there's actually testing went on today in the Stanford parking lot. Will go on again tomorrow, as well as the 29th and 30th. Let's see, there's a mask distribution as well coming up on October 28th. We've distributed over 2,000 masks in North Fair Oaks to date. District update, Maggie reported that she had noted the parking of oversized vehicles on Hampshire Avenue. Those vehicles have actually been moved. That's the sheriff's responsibility, but those vehicles have moved out of there. On the environmental health update, Shrija mentioned this earlier, but there is now a team out for COVID compliance. They're called the Business Engagement Team. And again, to her point, the idea is really about education as opposed to citing, but businesses will be cited for violations. Let me just blitz through here real quickly. Cynthia Knowles discussed the Healthy Homes program. I'm not sure how many people on the council are familiar with that. It has to do with inspecting rental units. And what's really kind of neat is the WhatsApp unit. The WhatsApp application is being used for that. It's a video conferencing app that runs on less expensive devices and allows residents of those apartments to provide information about their apartment. The county will make sure that that any code issues are taken care of, condition assessments and things like that. So that's an interesting thing that's going on. Let's see, Sheriff's Department, just a couple more minutes. Sal Zuno, let's see, I guess Supervisor Slocum brought up an issue with a bar or restaurant at, it's the El Dorado on Middlefield that was serving alcohol without a license. Sal is going to investigate that and see what's going on there. He also reported that the graffiti task force is on top of an increase in gang graffiti in North Fair Oaks. There was also an update by John Stanfield on that. He talked about 18 graffiti incidents in the last 2 months. Apparently it's a tagging war and they're cleaning them up just as quickly as they get posted. Also out of Public Works, the Fifth Avenue landscaping is going to begin on the 16th of November. And Stillman reported as far as street repaving is concerned, Loyola is going to start on Monday the 19th. And I checked the Board of Supervisors agenda for today. They did indeed authorize the Director of Public Works to solicit sealed bids for the project. The bids are due on December 15th. Contract's going to be awarded on January for the Middlefield Road project. And yeah, the only other point I had was the code enforcement update. They are indeed hiring 3 to 4 positions, as Justin mentioned. And I think that's pretty much it from that.
Thank you again. Thank you again, Brooks.
Ever,
Linda?
Comment. We were told North Forward or whatever, NFO Forward was dissolved or no longer functioning. That historically was the outreach component set up for the council in conducting outreach. And that as community or Department of Community Affairs came in and started picking up a lot of that type of work, we were told, and this was months ago, that NFO Forward was dissolved. So I really be a good idea to get an update on exactly what the status is, because I really don't even know. Thank you.
I see a comment in the chat from Emma that says OCA is maintaining the NFO Forward website and can include our meetings on the calendar. So, I mean, to my eye, the site looks terrific. It was just there was nothing on the calendar. There's lots of good information out there, to your point, Linda.
Yeah, through the chair. So the North Oaks Forward website is still active and online with a bunch of updates, and it's bilingual, and our office does maintain it. It does redirect the council portion to where the council video and agenda and items are now at, which is on the board, which is in the Board and Commission's website. So it's still being updated as well as the Facebook, but we are now, the community affairs and the outreach team, they outreach county-wide.
Right.
So it's not just specifically for North Oaks, but we continue to always, go out in the community and be part of the North Oaks community.
Which is a good thing. This is a good thing. I think the problem, and something that we can, improve next year, is the connection with the council, in informing the council, having some kind of a dialogue about the improvement on the county's end. The way it's set up, I understand it clearly. I think, though, at some point, the communication wasn't as good as it could be. And so there's been a lot of question about it. But thank you, Mitzi. Thanks for the clarification.
Yes, thank you.
Thank you.
Thank you all. And just before I adjourn, perhaps we will definitely table during the study session, talk about the potential impossibilities and updates for the North Oaks Forward site. And perhaps there'll be a good opportunity also to look into those files and see if there may be a subscribers list for the residents who used to get the meetings agenda. That could be someplace in there. It would be great if we could reinstate that rather than having residents resubscribe again. So thanks very much.
Yeah, thank you.
And so with that, we'll adjourn the meeting. Thank you all for your work. Good night, and we'll see you soon.
Good night.
Okay. Be healthy, everyone.
Thank you.
Yes.
Get out and vote.
Yes.
Yes.